Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Right, John, tell me what's going on with your elbow.
Pain down here,
Mm-hmm.
kind of on the bone. You kind of see like the
When you flex
right
it a
there,
little
the
bit.
pop. Yeah,
Oh,
once
I see that. Yeah.
Yeah, once I get up to here, it pops. Right.
How much
here.
pain from 0 to 10?
Just like this,
Mm-hmm.
almost none right now.
Okay.
It's when I put something heavy
Some
in my
heavy-
hands,
heavy
or if
weights.
it's.
Have you had any treatments like massage, chiropractor, PT, or
I did
acupuncture?
one massage
Okay.
and one acupuncture session,
Okay.
just to see.
So I want you to show me the motion that's aggravated. I have like a 5 pounds, so we'll have you do bicep curl and you do twisting, and give me numbers how much pain, because we will use that for after treatment to see how your body responds to the treatment.
Okay. So here,
Mm-hmm.
there's no pain.
Okay.
No pain.
Mhm.
No pain. Here is where I start feeling
How much pain
the
there?
pain.
What have you done?
I'd say probably
How much?
maybe about a 4.
Okay, so you about like 85 degrees. Okay.
Mm-hmm.
Okay.
And then it's just continued pain when you
Okay.
go up, about the same amount,
Uh-huh.
but-
And you feel it here.
and it's down the same spot.
Okay, so we started with the 85 degrees, which that's when you feel it. Okay, I want you to really rotate this way.
No pain there.
Okay.
I feel it when I go
you
that way.
supination this
Yes.
motion. Okay, how
Same-
much from
same
0 to
spot
10?
on it. Maybe same, about a 3, 4.
Okay. So 85 degrees, so we're gonna work on that. Make sure what I'm doing is not painful. Okay, let's pull this up.
Ooh, I felt that one.
How much pain there?
That was a shock. So that was probably about
In here?
a 7. No, like on that bone. When you were like squeezing like that,
Mm-hmm.
down here on that lower bone.
This one.
Yes, that one right there.
Yeah. It's very common with the golfer elbow that a lot of scar tissue in this area. That's why you get that range of motion. You know, your muscle should act like a rubber band.
Mm-hmm.
So when it contracts and relaxes, it does this. When you have a scar tissue, it's like you have another rubber band. So your muscle is not stretching.
Right.
You are fine here, but when you start to really get more, you need more length of your muscles, you start to feel it because that's scar tissue in the way.
Right.
So is it 85 degrees with the weight, or it does not matter? Just
Any type of weight intensifies it.
intensified.
Right.
So okay.
Right.
So let me see your range of motion now without the weight. How like stop when you feel pain. How's that?
I can feel it. Yeah, once it starts getting
Yeah, show me where you start to feel it.
here.
Okay, so you already passed kind of like
Mhm.
90 or something. Okay. And this is the one you said it's like the
It
tendon
pops. The tendon
pops.
pops over it.
This is the
yeah.
one you said it's
Yeah,
pop.
that like that one.
You
right
can actually
there.
feel it.
Uh huh.
Like with my hand, and actually can feel it like popping.
Mhm.
Here.
Mhm.
Oh,
So when I make this muscle, once I go past a certain point, it pops like
yeah,
almost
that's
over
that.
it.
The popping, that's a scar tissue here. That's like.
Oh. Oh yeah, you can feel that one.
Oh.
We find it.
That's
Did it pop?
it.
Did
We
it pop?
found it.
That's it. That's it.
That's it. So let's lift your arm and tell me how's your shoulder feel. How's that?
Yeah.
Can you tell any difference?
This way I can't. I mean, I don't know what the
Normal
It just
should be,
feels.
shouldn't be go up like this.
Yeah, it's.
Okay. What about this one? And do the side. Where do you feel the tightness here?
That one in the back right here, when I go up this way.
Okay. Where do you feel the tightness?
Same. Right here.
Right in there.
Mhm.
Okay. What about, let's do the bending the elbow. Okay. Do you feel,
Yeah, it just feels like it won't move past the point.
okay, relax. How you decrease your risk of having this in the future. If you follow this instructions, you're not gonna injure it.
Okay.
You know, unless it's an accident, you know.
Of course.
So, and that's the goal, is to empower patient to do the right thing, so this way we don't have to, like in a few months, he did the same thing and injured again, you know.
Makes sense.
Prevention is actually is the key.
What?
How's that? That's a full range of motion here.
Mm-hmm.
That's good. Okay. Let's do the abduction side and bring it up. Look at that.
Did it feel like you achieved more?
Yeah.
Oh,
he,
yeah.
he was like almost 100, 115,
Right.
110.
Yeah.
Yeah.
Yeah, I can see the difference. Uh-huh.
And I worked on his head.
You can feel like a point where like it rolls through almost right there.
Yeah. You know, tension headache, you have to do the soft tissue. It's
Yeah.
not, tension headache usually fascial restrictions, scar tissue,
Yeah.
all over the head area. And you have to be manually break it down. Is that too much?
No.
I should have taken his range of motion here, because this was as bad as the other one. Let's do the front and flexion. Can you tell a difference here? Oh man, we should have taken that range of
Yeah.
motion before. Can you tell a difference? And do the side.
This one feels a little stiff still.
Yeah, it's stiff.
The end range of motion.
I mean, you can force it.
That's it.
Let's do this.
The funky chicken.
Okay, he's compensating a lot here. Okay, relax. This is, well, usually you're gonna gain this flexion and abduction
Uh-huh.
before we getting this. There's a lot of things we have to clear it up here. But I'm very interested to see, because he started to get more range of motion in his shoulder when we worked on here,
Mhm.
scar tissue in the head and the fascia restrictions. I'm interested if that's gonna make a change here.
Oh.
So, because you have the fascia system, it's wrapping the entire body, the superficial layer.
Right.
So, think about this way: fascia, the superficial layer, it's like a Spider-Man suit,
Yes.
very thin layer that's wrapping everything.
Oh,
When you have tightness, it's similar to you wearing a Spider-Man suit that 2 to 3 sizes too small.
okay.
So if the tightness here that make it the size small, it could restrict everywhere else. You know what I mean?
Right.
As a compensation. So when we work on the fascia, it's really, we work on the system, not body part, because fascia is not body part.
It's just the external.
It's wrapping everything.
Yeah.
It's like your skin. It's everywhere. It's connected, you know.
True.
You had treatment before, so can you tell me, like, do you feel any difference between ASTR and what you had before?
Oh, well, the other treatment I didn't feel did anything for it. I don't know if that's supposed to be longer term treatment, the other one, but this one I feel an immediate relief of pain.
That's
So,
good. Yeah. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos We'll see you soon.